My dream would be that everyone would get the support they needed and that stigma would be erased. That would be my dream.
I would want to see more in suicide prevention. I would like to see more active prevention measures where suicide prevention and suicide itself is addressed more directly. And I would like to see intermediate stabilization facilities where individuals can walk in and just get that short-term support so that they can get back on track without having to worry about losing employment because they've got to go into an inpatient facility or disrupt their relationships and their life just so that they can get that support they need. I'd like I said, to see the decriminalization of mental health. So in my mind, what that means is that law enforcement is no longer the primary or first responder to a mental health crisis. Just think of the resources, the officers that are freed up for that. If we took mental health out of there, that would free up more officers, more resources to handle the calls they're supposed to be handling. So that's my ultimate vision, that's my dream, and I hope that we get there in 10 years.
I would love to see mental health separated from law enforcement. So if you have an individual who's in crisis because of mental health issues, I would love to see a team other than law enforcement respond to that situation. I'd love to see us have those crisis centers that we've been talking about for how many years. I'd love to see those up and running so that there's a place to take people who are having a mental health crisis.
In 10 years, I would like to see not only in US, not only in India, but world over. Mental illness, one, there has to be a lot of focus on mental illness because it's really the mind which is really dictating everything for you. If your mind is not in the right place, if it's not healthy, then believe me, you will not be a person who's working to your potential. So in 10 years, I want us to be in a space where a person is not judged for having to live with a mental illness. We are in a place where someone can speak openly about their mental illness, and just as someone would talk about any other form of illness in their body. And yes, then there are resources available to really, whether it's a medical intervention or non-medical intervention, take care of yourself, not only outside, but more importantly, inside.
I think in 10 years, if we can get to that place where we can talk about it, we can talk about suicide, I can talk about my mental health. I'm blessed to work in a place where if I say I need a mental health day to day, I'm just not firing right, but I get that day off. Not everybody has that ability and that capability. And I think as we're moving as a state and nationally, really recognizing that we can have normal lives. Sometimes we just need some help. We just need some assistance. We need to have that little help walking down our pathway just to make it to that next day or that next step and then regroup. And so I think really in 10 years, if we can have all the resources that we need that are easy to get to and easy to gain, and there's no ramifications for us reaching out, I think we'll be in a better place.
I would like to see it in the coded books right next to heart disease, right next to diabetes. It is not treated as fairly as other health conditions. And what I would like to see is when, insurance cover the same for mental health care as it does for heart care, liver care, pancreas care. It needs to be equal to any other health condition. It is a condition. The brain is a very, very large organ. Not one of us can operate without it. It's just like your heart. And so 10 years from now, I would like to see every person that needs mental health assistance be able to get it without all the barriers.
I would love to see the conversations just being had, and also accessibility. It's so important, and availability of resources as well. Programs within any sector, within the schools, in jobs, both the private, nonprofit, obviously, within homes, between parents and their children. Mental health is it's not just living with a mental health condition or not, it's our everyday lives, and just being able to really channel that aspect of our lives. I have high hopes.
I think the biggest change I'd like to see or improvement in mental health is removing some barriers to treatment. It seems like something has to happen or a crisis has to occur for anyone to take it seriously or pay attention. And that's difficult because it puts the individual at risk, for issues with law enforcement or relapse with their own mental health. Early intervention is a big thing. And also just having a level of education for everyone that even if they don't specifically have a loved one with mental illness, or they don't feel personally impacted, they'll have that knowledge. So if something does come up with themselves or with a loved one or someone they know, they'll know what to do and they won't be scared of it. And that's really my hope, is less fear and less barriers.
My vision is that everyone reacts to a mental health condition the same way we react to any other condition. So if you feel like you're able to tell someone, God, I might be getting the flu, a little nauseated, got a little bit of a headache, that someone would be able to say, I'm really feeling a little insecure here. I'm not sure why something has triggered me or something has made me anxious. So they can talk to someone, and that someone else says, well, maybe you should go home and take some nausea medicine if it's the flu. The same way, well, what can we do? What can help make you feel better? The fact is there are so many people, and with the pandemic, we are more aware of it. Why did it take a pandemic to make people aware of something that we who have worked with mental health conditions and in this universe have always been aware of, and now the commonplace man, woman is more aware of? But why did it take a pandemic? But now everyone has felt a certain amount of depression, a certain amount of anxiety. And what I ask people to do is multiply that by like 1,000 and live with it 24/7. And now you've maybe got a taste of what's going through with people who have experienced these conditions. So it's sad that everyone's experiencing, but I'm kind of happy that everyone's experiencing so that they can at least get a touch of what's going on with people. And that it's nothing they do. It's not their fault. So I would like that to be more commonplace.